Alright guys, just a reminder, this is not official medical advice or such. Please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with another weekly podcast of the Common Sense MD. Today I want to talk about pain. You know, really, in my 40 years of being a doctor, most people my age or younger even, a lot younger a lot of times, come to a doctor for one or two reasons. Either they're tired or they hurt. Very common. We see that every day in the office if you're a physician. Chronic pain is very subjective. And nowadays, doctors are hesitant to treat chronic pain because it is subjective and, you know, it's hard to treat nowadays. It's justifiably so because doctors are scared of losing their license after the opiate crisis, and justifiably so. I mean, there were abusers, but there was also people that had legitimate chronic pain, and they come in every day. Unless you're a pain clinic, you really can't prescribe opiates much more than a day or two as a regular physician. So we've come up with better ways to deal with this. Besides opiates, you know, they're effective for very short periods of time in most people before you get tolerant, and then you become addicted. So opiate, the crisis was horrible, and hopefully we're coming out of it. I think we are. But so doctors are hesitant to treat about it. A lot of times they're not convinced that your pain is there. Maybe they think it's in your head, but most of the time it's really not in your head that I've found. Most of the time, doctors prescribe nonsteroidal anti-inflammatory medications like Motrin, Naproxen, and the newer generation of NSAIDs like Mobic, which is meloxicam or Celebrex. But they're really not all that effective. They can cause a lot of side effects, GI side effects, of course, renal problems. They can even raise your risk of heart attacks. So people don't like taking those chronically. I certainly don't. Because really, usually inflammation is at the root cause of the problem of most chronic pain, as well as most diseases overall. So really, if you can tampen down the inflammation in a more natural way, you're going to hurt less and be healthier in all aspects of your life. There's a lot of natural supplements that most of you know about that we've used for a long period of time that can be very helpful, I think as helpful as NSAIDs, with way less side effects. Because I like to create my own vitamin formulas, I'm a big vitamin nut, have been for many years. I do my research. I found a pharmacy in Oregon that makes vitamins according to my specifications. The company is called Freedom to Formulate. I've got some great pharmacists that I work with that are very knowledgeable, and they're above board in every way. I've had some great success with a lot of my vitamins. I'll put a list of the vitamins I've come up with in the last few years. So I like this company because they put the ingredients I want in there, and they put the amounts I want, and they combine the ingredients that I want combined. Really, it's very effective because they work synergistically, and it makes it much more cost-effective. But I like the Freedom to Formulate folks. They're really great because they don't put fillers in there. You know, they just don't put artificial fillers in their formulas. They date the vitamins. They have a 2-year shelf life without refrigeration, and they're domestically or European sourced, so they're not coming from India or China. And I've really worked with them for a long time, and I really like it. But the reason I'm telling you about this is because I've come up with something I've been working on for over a year. It's my own pain formula. I've worked on this, done a lot of research, tested a lot of different things myself, and I've come up with something I think is really good. It's my pain formula, and I'll tell you what's in it in a minute. But I've been taking it for about a month or so. I've tested out on a lot of my friends and some patients, and I'm getting great results myself. I have a lot of arthritis, degenerative disc disease in my lower back, which I've talked about a million times. I've even shown my x-ray on this show. It looks pretty bad. But I certainly don't want to take any pain medications. Occasionally, in the past, I did take, Motrin occasionally, but I don't have to do that anymore. And the other thing about it, since I've been taking this formula, I can drive to my Knoxville office and back and not have to get out of the car to stretch my back because I'm in a lot of pain. So that's the first thing I really noticed about it was driving in a car for longer periods of time without pain. But anyway, so here are the ingredients. And a lot of them you'll be familiar with, some of them you may not. Turmeric, of course. Turmeric extract is rich in curcumin, have boswellia extract, and both those help chronic inflammation and support joint health. MSM, a favorite of most of my orthopedic surgeon friends. It works way better than the glucosamine chondroitin. If it has MSM in it, it's usually going to work pretty well. But what they do, they further aid in joint flexibility and reduce swelling. Willow bark dry extract, which is a natural salicylate. Think aspirin. It's very similar without some of the side effects of aspirin. I'm a big fan of aspirin, but a lot of patients can't take it, and they prefer something natural, and I always say willow bark. So I put that in there. Boswellia, that's another one that I put in there, which can really improve joint function a lot. I found it to be very helpful for that and a bunch of other stuff as well. Bromelain, that's an enzyme from pineapples which help reduce inflammation and swelling. And the secret ingredient in my formula really is paractin. It's a standardized extract from something called green carreta, which supports a healthy immune response to inflammation. And of course, black pepper extracts in there to enhance the absorption of all these ingredients, ensuring that you get the full benefit out of this formula. So if you suffer from chronic pain, joint discomfort, or any type of inflammation, I think this supplement can provide a natural, well-rounded solution to help you find some relief and hopefully improve your quality of life. Of course, these statements have not been evaluated by the FDA. They don't do that with any vitamin. But it really makes a lot of common sense that you can combine these great compounds, which are useful for a lot of other things as well. Go read about every one of them individually. But it makes sense to me. So if you look at it, I think you'll be impressed. I was getting some reports from some of my patients that things like relief factor that you see on TV all the time was helping them. So I looked up the ingredients, and it really wasn't much. I mean, most of the other stuff like omegas in there and resveratrol, you're going to take for other reasons anyway. I didn't see much in there that compared to anything like this thing. So I picked these out individually, and with the help of my pharmacy friends at Freedom to Formulate, came up with this over the past year. Chronic pain can wreak havoc on your life. It really can. And of course, you want to stay away from inflammatory foods. This is not the only thing you can do. The most important thing you do is eat right, stay away from inflammatory foods like sugars, glutens, dairy, soy, corn, maybe nightshade vegetables. Sugar is the worst. You need to do that for sure. You need to move your joints. Your joints are meant to move, and if you don't move, you're going to hurt. You're going to get stiff. You need a good night's sleep. You need to decrease your stress levels, definitely related to chronic pain. And I always look at your hormone balance as well. So I like this formula. I've named it Dr. Rogers Pain Formula. Try it. I think you'll probably like it. Give it a try. It's certainly helping me. Doctors are supposed to be folks that help ease your pain. It kind of reminds me of that movie Field of Dreams, where that secret phrase was, help ease my pain. If you've seen that movie, if you're a baby boomer like me, surely you've seen that movie with Kevin Costner. But so as doctors, we do try to ease your pain in a natural way, a natural, safe way. So check the ingredients out. If you want to give it a try, contact one of the offices. It's always on my website. I hope you have a great pain-free week. And this is Dr. Rogers. I'll see you next week. Thank you.